Senator Cormann.
Thank you, Mr. Acting Deputy President. Mr. Acting Deputy President, I've said it before and I say it again. The Rudd Labor government has been an absolute failure in the health portfolio. The Rudd Labor government has been a complete and utter failure in the health portfolio. And Nicola Roxon, the Minister for Health and Ageing, is a very lucky lady. The Health Minister is very lucky that there is so much incompetence going around the Rudd Labor government right now, with Minister Garrett and Minister Conroy and all this incompetence going around the Rudd Labor government. She is able to hide under this carpet of incompetence. Because if it wasn't for Minister Garrett and if it wasn't for Minister Conroy and if it wasn't for some of those others that are performing absolutely disastrously in the administration of public policy, then surely Minister Roxon would be under some very, very serious pressure. Because before the last election, the Rudd Labor government promised the world in health. They promised the world and they've delivered next to nothing. They overpromised, they've underdelivered, it was all talk and no action. Before the last election, we were told that only Labour had a plan to fix public hospitals. Only Labour had a plan to fix public hospitals. And yet, after the election, did we see the implementation of any semblance of a plan? No, we didn't. We got a 20-month review, and even after that review recommended, we now have a review into the review and a whole series of photo opportunities around Australia for the Minister for Health and Ageing and the Prime Minister. No, not one single decision, just bureaucratic reviews onto the never-never, and no doubt, like we've had with the promise now to take Japan to court over whaling in November, we will get an announcement in the next little while as to what Labor would do should the Australian people be unfortunate enough for them to get re-elected into government after the next election. So, Mr. Acting Deputy President, I put you on notice. You should take a very careful look at what is coming out of the Rudd Labor government over the next few months, because I wouldn't be surprised if we got another promise and for the Australian people to be asked to take the government on trust moving forward. But our message to the Australian people is you cannot trust a single thing that's being said by the Australian people. You can't believe a single thing that's being said by the Rudd Labor government on health. Now, the other, cooperative federalism on health. We were promised that the buck would stop with the Prime Minister. What have we seen? I mean, the states and territories have been giving the Rudd Labor government the runaround. Kevin Rudd is now using the states and territories as an excuse as to why they're not able to follow through on some of the promises they made before the last election. And of course, we had the most emphatic promise that the Rudd Labor government would maintain the existing private health insurance policy framework, and very specifically in relation to the private health insurance rebates. The Rudd Labor government told us and told the Australian people that they would retain the existing private health insurance rebates, including the 30% general rebate and the 35% and 40% rebates for older Australians. And Kevin Rudd must have thought this is pretty important. It's a pretty important promise to make in order to win the election in 2007. Because 4 days before that election, on the 20th of November 2007, Kevin Rudd, as the then leader of the opposition, wrote a letter to the Australian Health Insurance Association to give an absolute ironclad commitment. An absolute ironclad commitment. He must have thought he needed to do this in order to win some votes, because, Mr. Acting Deputy President, what else, why else would the Leader of the Opposition bother to write a letter to a gentleman called Dr. Michael Armitage, who is the Chief Executive of the Australian Health Insurance Association? If he didn't think it was important to win some votes, if he didn't think that the people of Australia thought it was important, why would he have bothered to write this letter 4 days before the last election? Of course he thought it was going to help him win votes to conduct this absolute, what we now know to be an absolute deception. Now, but Nicola Roxon, not to be outdone, herself as Shadow Minister for Health and Ageing, not only did she confirm the commitment to the private health insurance rebate, she actually went a step further. She accused those of us who were questioning the sincerity of Labor's commitment to the private health insurance rebate of running a scare campaign. She put out a press release, again in the lead-up to the election, 26th of September 2007, Federal Labor rejects the Liberal scare campaign around the private health insurance rebates. On many occasions, for many months, Federal Labor has made it crystal clear that we are committed to retaining all of the existing private health insurance rebates, including the 30% general rebate and the 35% and 40% rebates for all Australians. The Liberals continue to try to scare people into thinking Labor will take away the rebates. This is absolutely untrue. And then the clincher. The Howard government will do anything and say anything to get elected. And now, of course, we know that it was the Rudd Labor opposition, now the Rudd Labor government, that was prepared to say and do anything in order to get elected. And it is very clearly a fraud committed on the Australian people, on the voting public across Australia. And of course the deception continued in government. Like the deception continued in government. After the election of the Rudd Labor government, we thought, well, we better check that what was said before the election is indeed what will happen after the election. And we asked questions, and the officials that are sitting in the advisors' box would well remember that estimates after estimates we asked questions, trying to find out whether the government indeed was and continued to be committed to retaining the existing private health insurance rebates. And as late as the 24th of February 2009, the Health Minister Nicola Roxon said, and I quote, a direct quote, "The government is firmly committed to retaining the existing private health insurance rebates." Firmly committed to retaining the existing private health insurance rebates. Now, what we found after that, of course, is that while the Minister was making that statement on the public record, officers of her department at the Minister's instruction were working up the proposal that we are discussing in this chamber today. That is deception at its worst. It is taking the Australian people for mugs. Now, this is bad public policy, and I will get to the argument as to why it's bad public policy. But what is really offensive about this is the absolute brazenness with which the Rudd Labor government and the premeditation with which the Rudd Labor government has deceived and set out to deceive the Australian people. Now, we are really debating this legislation the wrong way around. I understand why the government now wants to deal with that part of the Orwellian named Fairer Private Health Insurance Incentives Bill first, that relates to the Medicare levy surcharge changes. But of course, the bills that we are discussing at the moment are nothing more and nothing less than consequential bills to try and mitigate some of the impacts of what the government is really about. What the government really wants to do is to reduce and to scrap the private health insurance rebate for millions of Australians. What the government really wants to do is run its ideological attack on private health insurance, irrespective of the pressure it will put on public hospitals, irrespective of what it will do to our health system, irrespective of what it will mean in terms of fewer people in private health, irrespective of what it means to private health insurance premiums moving forward. So the objective that the government is pursuing is that it wants to reduce or scrap private health insurance rebates. This legislation that we're dealing with at the moment is an attempt to stop those people who will see significant increases in the cost of their private health insurance immediately as a direct result of this legislation, to try and stop them from leaving private health insurance. So when we were in government, we introduced a package of carrots and sticks to support those Australians who take additional responsibility for their own healthcare needs by taking out private health insurance. The government wants to reduce the value of the carrot, and it wants to increase the cost of the stick. Like Senator Fierravanti-Wells has said, this is nothing but an additional tax hike, something that the government never said before the last election they would do, of course. Now, this, of course, comes on top of previous changes that the government has made to the private health insurance policy arrangements. Because, you'd remember that in Labor's first budget, they already made changes to the Medicare levy surcharge thresholds, even though they said before the election they wouldn't, even though they confirmed after the election that they wouldn't. They, of course, in their first budget went ahead with changes to the Medicare levy surcharge thresholds. And their initial proposal was to see a reduction in expenditure on private health insurance rebates of about $960 million, on the basis that Treasury and the Rudd Labor government expected 644,000 fewer Australians to be in private health insurance, or in private hospital insurance rather, than would have been the case before those changes. And I just remind the chamber that the government, with those changes 2 years ago, a year and a half ago, set out to take $3.2 billion out of the health system. Because I mean, the government was there aiming to save $960 million for private health insurance rebates that no longer would have to be paid to those people walking out of private health insurance or not taking it up. And the result, of course, very clearly, was going to be $3.2 billion less in resources for our health system as a direct result of what the government was doing. Now, the Senate, ultimately, the opposition didn't support the decision that was ultimately made by the Senate, but at least the Senate forced the government to water down those changes somewhat. But still, that initial change, according to the government's own figures, was going to result in a $740 million saving over the forward estimates in spending on the private health insurance rebates. So already, compared to what the government promised before the election, already the government now has to spend significantly less on the private health insurance rebate compared to what would have been the expected expenditure when the government decided on making its commitment to retaining the existing rebates. But furthermore, the government already, by saving $740 million on not paying the rebate to those people who will leave private health or those people who will not take it up, has already taken $2.5 billion out of the health system as a result of about 500,000 fewer people in private health insurance. Now, we've got to remind ourselves at this point that all the while this is going on, all the while the government is doing nothing to fix public hospitals, other than having reviews that go for months and months, other than pursuing broken promises, the government is spending billions and billions and billions of dollars recklessly across, whether it's pink bats, $2.5 billion, or whether it is Julia Gillard Memorial Halls for $14 billion, whether it is, you name it, like billions and billions of dollars of reckless spending. And who is being asked to pay the price? People across Australia who need timely and affordable access to quality hospital care. People across Australia who are making a sacrifice every year by taking out private health insurance, by taking additional responsibility for their own healthcare needs. They are the people that this cold-hearted government wants to pay the price for their reckless spending on insulation, ill-fated, dangerous insulation across Australia, for waste and mismanagement as part of the Julia Gillard Memorial Halls program, for $900 checks to people overseas and dead people and people in jail. This is what this government is all about. Now, as I've mentioned, the effect of this package of bills very clearly will be that fewer people will be in private health insurance as a result. There will be upward pressure on the cost of private health insurance, which again will see more people leave. All of this will put additional pressure on our public hospitals. And of course, we go back into this old-fashioned Labour Party-induced vicious cycle in our health system. Because I just remind the Chamber, as I've reminded the Chamber before, the Labour Party has got form on this. The Labour Party, when they get into government, they attack people with private health insurance. And in so doing, they put our health system out of balance. Our health system, the policy challenge for us, Mr. Acting Deputy President, is to ensure we've got a health policy framework and a health system in which all Australians can have timely and affordable access to quality hospital care. And the best way to achieve it is through a well-balanced mixed health system with both a strong and well-funded public system and a strong and well-supported private system. Now, when Labor was last in government, they did exactly this sort of stuff. They pulled these sorts of stunts. And of course, the proportion of Australians with private health insurance went down from about 63% to about 30% before we were able to turn it around. Now, Labor today will tell you, well, it's not happened. You see, you said all these terrible things would happen last time. Never mind that it was Treasury estimates which predicted that 644,000 fewer people would be in private health insurance as a result of these changes. Never mind that these changes don't happen within 24 hours having been passed through this chamber, as much as Labor might like otherwise. I mean, when we were in government when we got into government in 1996, it took 2 or 3 years before our changes started to take effect too. What I'm concerned about is if this Senate were to allow the Rudd Labour government to continue going ahead with these sorts of terrible, broken promises, which will make it harder for Australians to afford private health insurance, then we will see very, very bad consequences for our health system moving forward. Maybe not immediately within 24 hours of passing the change, but over time, because that's what happens with social policy changes. Now, Mr. Acting Deputy President, we of course did propose a better alternative to this. We proposed to increase the excise on tobacco by 12.5%, which would have raised about $2.2 billion over the forward estimates, according to Treasury evidence and estimates, which would have raised about $300 million more than the $1.9 billion the government is trying to save through this measure over the forward estimates. Now, this happens to be consistent with one of the recommendations from the National Preventative Health Task Force. Another one of those reviews which the government has left on, on a cupboard somewhere, like which they've received at end of June last year, and which since nothing has happened with. One of those many reviews that the Rudd government is so good at instigating, but without taking any action as a consequence. But has the government taken on board that very constructive suggestion we've made? Of course not. Silence. See, this is not about saving $1.9 billion. If it was about saving money, the government wouldn't have been out there wasting billions and billions of dollars on dangerous home insulation programs. They wouldn't have wasted billions and billions of dollars on Julia Gillard Memorial Halls, replacing school buildings that were perfectly functioning and perfectly okay. This is about an ideological war which the Labour Party has been pursuing for decades against people with private health insurance. It's about an ideological war against those Australians who take additional responsibility for their own healthcare needs. It's about wanting to put the health system out of balance. It's about destroying private health insurance. This is what this is all about. And of course, because that's why, of course, the Rudd Labour government never even entertained the alternative that we've put forward. Now, and of course, like here we are, the first piece of legislation coming back after the House of Representatives passed the other greatest moral challenge related legislation of our current time, the ETS, the flawed ETS. So we're dealing with this, a broken promise, instead of dealing with the emissions trading scheme. Where is the emissions trading scheme on the list? It's way down, way down. And I suspect that the Labour Party in their caucus is getting increasingly uncomfortable about the lack of popularity and the fact that people across Australia are starting to understand what a dog of a scheme the ETS is, that great big new tax which Labour wants to impose on everyone. So why are we dealing with this now, even though the government already knows that they do not have the support of the Senate for it? The reason we're dealing with this is politics, because the government just wants to collect another double dissolution trigger. This is not about health. This is not about doing the right thing by our health system. This is not about making sure that people across Australia can have timely and affordable access to quality hospital care. This is about the Rudd Labour government's political strategy. It's about covering up that they all talk and no action. It's about running away because they want to try and get away from the impact of the emissions trading scheme. And surely, I'm sure that right now, behind the scenes in the Prime Minister's office, there's people the hollow men of the Prime Minister's office are out there plotting and scheming to sort of see how they can get their head out of the noose as far as the emissions trading scheme is concerned. So here we are. Here we are dealing with what is a blatant broken promise. We're dealing with something that is a bad public policy measure, which will be bad for our health system. We're dealing with something that the Rudd Labour government promised emphatically before the last election they would not do, all at the same time, while the government has done nothing, has done absolutely nothing to deal with the many challenges in our health system. Like I say it again and I conclude on this point. Before the last election, the government promised the world in health. Only Labour, according to the Prime Minister, had a plan to fix public hospitals. Well, Prime Minister, where is your plan? When are you going to start implementing it? When are you starting to make decisions that will actually improve things in our public hospitals, rather than to pursue these blatant, offensive, broken promises which will make things worse in our health system, not better? We're all waiting. We're all waiting to see it. And when you finally get around to make a decision about the review and the review into the review, you better make sure that there's some tangible action, some real decisions, rather than yet another bureaucratic process on the never-never. Because, Mr. Acting Deputy President, the people of Australia were promised that there would be some tangible improvements to our health system. So far, all we've had is things that would make things worse. It is time that we got some real action rather than just talk in the health portfolio.